A Virginia law meant to protect consumers is now hurting some moms-to-be.
Local legislators want to change the law, but in the meantime, babies could be dying.
Pharmacists say their hands are tied when it comes to providing a drug to protect moms and their unborn babies.
10 on your side's Melanie Woodrow is here to explain this all to us. Melanie.
Nicole and Stephanie, the drug is given to women who are not producing enough progesterone during pregnancy. Until recently, pharmacists have made the drug themselves, charging very little for it. Now that a pharmaceutical company is manufacturing the drug, many women won't be able to afford it unless Virginia law is changed.
What you're looking at here are the raw ingredients.
Since 1990, Pocosin pharmacy owner David Creasy has been compounding 17-HP.
And what's coming out is actually a sterilized drug into a sterile vial.
It's a drug given to pregnant women who aren't producing enough progesterone. Progesterone is a naturally occurring hormone in the body. Without enough of it, a mom-to-be could deliver prematurely or have a miscarriage. A Virginia law gave pharmacists like Creasy permission to make or compound the drug.
There were places you could buy it for as little as $10. It could be maybe in the $35 range.
Recently, KV Pharmaceuticals started manufacturing the drug and charging much more.
Their cost is $1,500 per dose. You're going to take a pregnancy now and you're going to basically add about $30,000. When it first broke, it was probably daily, several phone calls a day with women literally in tears. Literally in tears. What am I going to do?
Insurance doesn't always cover the cost of the drug. What's worse, the same Virginia law that permits pharmacists to compound drugs prevents them from making drugs that are commercially available.
This is an issue that probably is going to take a legislative fix. And as you know, the legislature doesn't meet until January. And so we're talking about almost a year away before we could really get a fix. In the meantime, unfortunately, patients may go without this medication and may lose children over it.
Creasy is hoping the legislative fix will prevent something like this from ever happening in Virginia again.
That's one of the reasons we need to fix this. We don't know what's down the road.
I spoke with Delegate Chris Jones on the phone. Jones is a pharmacist and shared Creasy's concerns, but he said for the moment he and other local legislators have been focused on the redistricting issue. Melanie Woodrow, 10 on your side.
Melanie also reached out to KV Pharmaceutical. A spokesperson said in part, the price reflects the cost of manufacturing and getting FDA approval.